Good evening, and thank you so much for tuning into another episode of the Medi Health Show. We are live at GTN TV studios here in Othaya, and today you're going to be talking about arthritis. With me here is Dr. Kelvin from Equity Afya, and thank you so much for making time for us. Karibu tena.
Thank you so much for having me. It's an honor to be back and also to help the society know more about arthritis.
Yeah.
Yes.
Thank you so much. We trust you are well.
Yeah, I'm okay.
So we're going to be talking about arthritis, and out there we might know you'll have pains, in your joints and everything. Yeah. But from a professional, what is arthritis?
So we define arthritis as the inflammation of one or more of your joints, of a joint in the body. Yeah, so that is it, just inflammation of one or more of your joints. Yeah.
Is it any joint, or there are some joints that are quite common that people will complain that I have pain in these particular joints?
Yeah, the most commonly affected joints are the knee joints, the wrist joints. We have joints on the fingers. We also have the elbow joints. We have the spine and the hip joint. Yeah.
And the back?
Yes, the back, the lower back, the spine. Yeah.
That is all arthritis.
Yes.
Yeah. And is it common in a specific group of people, like maybe it could be with age, or can it affect anyone?
Yeah, most people that are affected by arthritis are people of the middle age, mostly maybe 40, 45 years and above. But we have types of arthritis that may affect younger people. Yeah.
And what are these types of arthritis? Because when you say that now, it becomes like it's not only one type of arthritis. We could have types. Are there types of arthritis?
Yes, we have various types of arthritis. And the most common is the osteoarthritis. Osteoarthritis mostly affects the knee joints. Yeah. So osteoarthritis is also known as wear and tear type of arthritis, because the joint is where two bones meet. So when there's something known as the articular cartilage that joins the one bone to another. So we call it wear and tear because the articular cartilage is the one that is damaged. So when it is damaged, you have the two bones grinding on each other. So that is how the osteoarthritis is formed. Yeah.
And another of the common types of arthritis is rheumatoid arthritis. How do you distinguish that from osteoarthritis?
So rheumatoid arthritis is caused by the body itself fighting. It's the body fighting itself. Yeah, it's an autoimmune form of arthritis. It's the body fighting itself, and it mostly affects the joints of the hands, the wrists. We have joints of the fingers known as the metacarpopharyngeal joints. Yeah.
Now, if it's out of the body and it's being caused by a person's immunity, that means could be complicated. Does that mean anyone could get it? But I will get to that. And we also have gout, which has been associated with arthritis. Maybe you could break it down to us how.
Yeah. So gouty arthritis is caused by the deposition of something we call uric acid. When uric acid is produced in the body, there's a way it's from the body. It's excreted from the body, but there are people who have a problem with the excretion of the uric acid. So ideally, when the uric acid is not excreted from the body, it's deposited into the joints, causing inflammation and thereby causing arthritis. Yeah, gouty arthritis.
So for someone to know that they could be suffering from arthritis, there are certain signs and symptoms they are going to experience. What are these signs and symptoms, and are they common? Are they cutting across all the types of arthritis that we've talked about now?
Yeah, there are major signs of arthritis. One is pain in the joints. the other one is swelling, and the other one is stiffness. So you can have pain. You can even have all of the signs affecting you. So they are mostly the major signs of the arthritis: the pain, the swelling, and the stiffness. Stiffness is where the mobility of the joint is affected. Yeah.
So you cannot move as much as a normal person would, or someone who is not suffering from arthritis.
Sure. Yeah.
And are there chances that the joints or the parts of the body that are aching due to arthritis, that they could become sensitive more than usual?
Yeah. Usually when the joint is affected by arthritis, it grows, the arthritis becomes worse with age, and when not managed, so the signs will become worse and severe. So if it's not managed in time, the pain will increase, the swelling will increase, and also the stiffness. And also we have deformities that are caused by the arthritis. You'll have, maybe you have seen people with deformed fingers, where the fingers are deformed. Yeah, they are not straight as normal. Yeah.
And all that is because of arthritis.
Yeah.
And I think in our community, it's quite common to hear people saying they have arthritis. People are looking for help, even from herbal, what would we call them, herbal doctors? Yeah, that means it's quite common.
It's very common.
What are some of the causes? What could be causing arthritis? Because a lot of people are suffering from arthritis.
Yeah. So one of the major causes of arthritis is advanced age. So as you grow old, you are predisposed to arthritis. Other things are maybe use of alcohol. It's also a major factor in arthritis, but it mostly because of the gouty arthritis is the one that is more common, caused by alcoholism. Something else is obesity, people with too much weight. Something else is the gender. There are types of arthritis that affect more female and other affect more males, because if you look at something like gouty arthritis, it affects more of male. Something like osteoarthritis affects females more. Yeah.
And are there chances that once physical activities, or what they do normally day to day, the activities they carry out, is that a risk factor? Could it predispose someone to suffering from arthritis, especially people who do a lot of manual work?
No. Exercise is not a cause of arthritis. In fact, exercise helps in the good maintenance of joints. So exercise cannot be a cause of arthritis. Yeah.
And what about the vice versa, someone who is physically inactive?
Yeah. So when someone is not inactive, there is a higher chance of having arthritis. Yes.
And are there some infections that maybe viral infections that could trigger arthritis, or any other infection, any other condition, or is arthritis just a disease that is going to occur on its own?
No, we have viral infections that can cause arthritis, but mostly for arthritis, as we have talked about the osteoarthritis and the rheumatoid, we've seen that rheumatoid is more common, more caused by autoimmune. So it's the body fighting against itself. But for something like osteoarthritis, it's the damage of the articular cartilage that is connecting these two bones. Something like gouty arthritis is caused by mostly the alcoholism, too much of nyama choma, something like that. Yeah. So those are the three main types of arthritis that are common in our society. Yeah.
And then you talked about the autoimmune kind of arthritis, the one that is we called rheumatoid arthritis. Now, in that case, because you're saying it's the body fighting against itself, does that mean that there is no way we can control this, that anyone is at risk of getting rheumatoid arthritis?
Yeah, there's no way of you can prevent the rheumatoid, but there are ways you can manage it because it's manageable through medications, through lifestyle modification, through exercise. Yeah, it's easily manageable.
And
You just have to catch it early. Yeah.
And for most conditions, every time we talk about a disease, mostly you'll hear that genetics or family history could predispose you to suffering from that condition. If in your family or in where you come from, someone is suffering from that, someone who share genes. Is it the case with arthritis? Could family history be a factor?
Mostly it will be because of the side of maybe the rheumatoid arthritis, because we are talking about the genes of someone, the body is fighting against itself. So it's not common for genetics to be involved in arthritis in most of the types of arthritis. But we can find that there's in a family, you may have people many people in a family getting arthritis, but it's not connected to the genetics. But for the rheumatoid, there is a higher chance that if someone from your family had rheumatoid, there is a higher chance someone else will get it. Yeah.
Thank you so much for the clarity. So mostly we've talked about age, and we're talking about older people that the osteoarthritis could catch up with you as you grow older. So, but do we have cases of children having arthritis? Is that possible?
Yeah, we have the types of arthritis that affect children, though they are not very much common here in the African setup. But most of the arthritis that we see on a daily basis mostly affect older people, middle-aged to the older people.
Thank you so much for that clarity. So now, suppose someone has arthritis and they have already come to you and you've confirmed they have arthritis. How do we manage it? Is it curable? Like totally, this person had arthritis, they've been treated, and now they don't have arthritis anymore.
So the main goal of arthritis is first to minimize the pain, because the pain is very unbearable. So you have first to do a background check and good history of the patient, and also a good examination, because you have to find out why the pain is there, because it does not usually mean that if you have pain in a joint you have arthritis. Yeah. So there are many causes of things. There are many things that may cause pain in the joints. So you have to do a good history and examination to determine whether the person is having the arthritis or it's something else that is causing the
And how will you determine that this one is just a random joint pain and this is arthritis? How will you diagnose that this is arthritis?
So there are many forms of diagnosing arthritis. First is imaging, but we've talked about the history and the examination that will lead you to the correct diagnosis. And then we have the imaging, you'll have the x-ray. You can do x-ray of the affected joint. In cases of rheumatoid arthritis, we have blood tests. We do a test called rheumatoid factor. If it's positive or it's reactive, then the patient is suffering from rheumatoid arthritis. And also for something like gouty arthritis, you check for levels of uric acid in the blood. So if they are high, then it's a sign that the patient is suffering from gouty arthritis.
Thank you so much. And does weather affect arthritis? That when you're talking about arthritis, I've realized mostly it's pain. It's going to be painful in the joints. So are there certain types of weather that are going to accelerate the pain? Yeah,
sure. Mostly when a person is suffering from arthritis, you'll hear them saying that pain is mostly in the morning or in the evening, because cold weather is associated with the arthritis. So it exacerbates the pain. So cold weather is more affects the arthritis. So you'll have patients saying that in the morning the pain is very severe. Yeah.
So, and with someone living with arthritis, someone who has arthritis already, can they exercise?
Yes.
Should they?
Yeah. As we talked earlier, we said that exercise is very important to the joints. So a person with arthritis, we do physiotherapy is one of the processes of managing arthritis. So a person is not restricted from exercising because you have arthritis. Yeah.
So it could be painful a little, but you still have to exercise. Let's talk about other ways that we can manage arthritis other than physiotherapy. What else happens when someone has arthritis? How do you help manage the condition?
So the other ways like lifestyle modification, as we said, because we've said that something like gouty arthritis is most caused by the alcohol intake. So the lifestyle modification comes in where you have to reduce or stop taking alcohol. Yeah. So we also have the people who are obese. So they have to look for ways to reduce their weight, and it will help very much in managing the arthritis. We also have pharmaceutical management, where you give medications for the management of the arthritis. Most of the medicines that are given, the drugs that are given, you will find that a drug will cater for the pain and also for the inflammation. Yeah. So first you have to determine the type of arthritis the patient is suffering from, and then you'll find the better medication for. Yeah.
And I hear a lot of people complaining that they have suffered many years with arthritis. So is it curable?
Yeah. So to some extent it is, but it depends with the severity. That is why we say that you have to catch it early for better management. Yeah. Because there are mostly in older people, we have cases where the joints is completely damaged. And something else about the management of the arthritis, there's surgery that is done where a joint is replaced by another artificial joint. Yeah. But those are cases where the damage is severe, and the patient cannot live with the pain. Yeah. Yeah.
And could severe cases of arthritis lead to something like amputation?
Not really. What happens is that if you catch it early, and if it's not managed well, we have those cases where surgery is done to replace the affected joints, but it has not been proven that it will cause amputation, because it's just the joint that is affected. It's not like the whole limb or the whole hand or the whole leg that is affected. It's mostly the joint. So the management is solely to manage the joint, to replace the joint if it's very damaged. Yeah.
And so you happen to mention that when someone has that arthritis could be certain types could be more common in women more than in men.
Yeah.
What exactly is bringing about that difference, given that you said that the arthritis is going to be common in women, and then you're going to have gout mostly in men?
Yeah.
Why is that?
For the case of something like gout, we've seen that in our society, alcohol is mostly consumed by men. And we've said that alcoholism is one of the major causes of gouty arthritis. So in that case, you'll have many males being affected by gouty arthritis. Yes.
They're taking more alcohol and more nyama choma than women. And so in the case of women, why is it that it's common in them? Osteoarthritis is common in them.
So for the case of women, mostly it's because of obesity. We find that many women have higher body mass. Body masses, body indexes. So you'll find them being affected by the osteoarthritis more than men. And also women are not very active, not exercising as much as men. So you'll have many of them being affected by osteoarthritis. But it does not mean that the male generation cannot be affected by osteoarthritis. Yeah.
Does not mean exactly that they're not going to suffer from it. So you've emphasized a lot on obesity.
Yeah.
How is obesity affecting the joints? How is it going to bring about arthritis?
So we've mentioned about the inactivity of joints. So you'll find that many obese people are not very active. They are usually not doing exercises. They're usually sitting a lot. So the joints will be affected by the being the inactive form of these patients. So you'll have the joints are not, because we mentioned about the exercise. We've said that exercise is very important to the good joints. So you'll find that the most of these obese people are not very active. So the joints, the arthritis will affect the inactive joints. Yeah.
Then another problem that a lot of people complain about, that we've also been able to say it's also, I don't know if we should say it's a sign or it's part of arthritis, is back pain.
Yeah.
So how should they manage back pain for those people with arthritis and they're also struggling with back pain?
Okay. So having back pain does not necessarily mean you have arthritis. That is why we said a good examination and good history is very important, because back pain does not mean you have arthritis. So you may have back pain because of many things. You may have had trauma to the back. You also have cases where people who sit a lot are affected by, you have back pain. Posture is is a common thing in how people having back pains. So back pain is not necessarily arthritis, even though we have cases of arthritis that affect the spine. So you have the many parts of the spine, so you'll have different arthritis affecting the spine. But before you get there, you have to find out if the pain, the back pain is caused by arthritis. Maybe it's just a muscular pain, just something that is not affecting the joints. It's just the muscles. Yeah.
And so in any case, whether it is arthritis or it's not, and